All right, today we're going to talk about something that's, well, kind of terrifying because it's a threat that grows completely silently inside the body's biggest blood vessel. We're diving into aortic aneurysms. And that's not just some dramatic opening line. It is the perfect way to describe what an aortic aneurysm is. The really scary part? Most people have absolutely no idea it's there until it's far too late. So what are we really talking about? In medical terms, well, the definition is pretty direct. It's a permanent, abnormal widening of the aorta. And the key words there are pathologic and permanent. This isn't just temporary swelling. This is a part of the vessel wall that has failed for good. Now, right off the bat, you need to know that not all bulges are the same. A true aneurysm is when all three layers of that aortic wall stretch out together, kind of like a weak spot in a tire. A pseudoaneurysm, on the other hand, is way more dangerous. It's basically a leak that's been temporarily plugged by the outer layer of tissue. It's a contained rupture, just waiting to break open. We also classify them by their shape. The most common one is called fusiform, where the whole section of the aorta balloons out symmetrically, kind of like a football. The other kind is saccular, which is more like a little bubble or a blister sticking out from one side. So the big question is, why? How does the aorta, this incredibly tough, high-pressure pipeline, just start to weaken and bulge out like that? Well, it all comes down to what's happening at the microscopic level. The whole problem boils down to just two things: the breakdown of elastin and collagen. These are the proteins that give the aorta its incredible one-two punch of elasticity and strength. Elastin lets it stretch, collagen keeps it from bursting. When you lose those, you lose everything. And here's the chain reaction of how that happens. It all starts with inflammation in the vessel wall. That inflammation triggers the release of these nasty little enzymes called MMPs. And these MMPs, their job is basically to chew up and destroy elastin and collagen. Once that happens, the wall just loses its strength. It's that simple. So what's causing all that inflammation and damage? Well, the number one culprit by a huge margin is atherosclerosis, hardening of the arteries. But some people are just born with a higher risk, like those with genetic conditions like Marfan syndrome. And what's the single biggest lifestyle risk factor you can control? You guessed it, smoking. It's absolute poison for your aorta. Okay, now where these aneurysms happen matters a lot. We basically split them into two main locations: thoracic, which is up in the chest, and abdominal, down in the belly. And the reason we separate them is that they are often very different beasts. And just look at the differences here. Thoracic aneurysms are often caused by something called cystic medial necrosis, a fundamental breakdown of the middle layer of the aorta. But you go downstairs to the abdomen, and bam, over 90% of them are caused by good old atherosclerosis. This changes everything from symptoms to treatment. For those abdominal aneurysms, there's one classic physical sign. During an exam, a doctor might actually feel a pulsating mass in the person's belly. Think about that for a second. That's the enlarged aorta, literally beating with the rhythm of the heart. It's often the very first clue something is seriously wrong. So we've established these things can grow for years without a sound. But there comes a point when the silence breaks. And when it does, you have to listen, because it's a sign of a looming emergency. Let me say this again, because it's the most important and dangerous part of this whole story. The vast majority of people with an aortic aneurysm have zero symptoms. None. You don't feel tired. You don't feel sick. You feel completely normal. So if it's completely silent, how in the world are you supposed to know that you're in danger? What's the one signal your body sends to tell you that a catastrophe might be just around the corner? The answer is pain. If someone with a known aneurysm suddenly develops new pain in their back, their chest, their abdomen, that is not just a simple ache. That is the sound of the aneurysm stretching, growing rapidly, and getting ready to burst. It is a massive red flag for an impending rupture. And if it actually does rupture, the situation becomes catastrophic fast. Doctors know this as the rupture triad. First, there's a sudden tearing pain. Then, a massive drop in blood pressure as blood pours out into the body. And finally, profound shock. It's one of the gravest emergencies in all of medicine. Okay, after all of that doom and gloom, here's the good news. We have really good ways to find these silent threats. And even better, we have great ways to fix them before they ever get a chance to rupture. So let's talk about the solution. When it comes to finding them, we have two main workhorses. Ultrasound is fantastic for screening. It's cheap, it's easy, and it's a great way to check on people at risk and monitor an aneurysm's growth. But when it gets serious and we need a detailed 3D roadmap for planning a surgery, that's when we turn to the CT scan. It gives us the precision we need. This is the million-dollar question, isn't it? We found an aneurysm, we're watching it. At what exact point does the risk of that thing rupturing become greater than the risk of a major surgery? For most abdominal aortic aneurysms, this is the magic number, 5.5 centimeters. Once it grows past that diameter, the risk of rupture starts to climb steeply, and that's when surgeons will almost always recommend fixing it. And this chart shows you exactly why that number is so important. Look at the bar on the left. For an aneurysm under 5 centimeters, the annual risk of rupture is really low, just a couple percent. But look what happens when it gets bigger than 5 centimeters. Whoa, the risk just skyrockets, sometimes as high as 20 to 40%. Size is everything. And when it is time to fix it, there are two main ways to go. The classic way is an open surgical repair, where a surgeon literally cuts out the bad section of aorta and sews in a new, strong synthetic graft. The more modern option is an endovascular repair, where they snake a stent graft up through the arteries in your leg and apply it inside the aneurysm, essentially relining it from within. If you remember one single thing from this entire explainer, please let it be this. The single most important factor, the one that guides every decision we make about aortic aneurysms, is its size. Simply put, size predicts rupture. And this brings us to the future of treating this. Right now, for smaller aneurysms, our main strategy is just to wait and watch. But what if we didn't have to? What if we could find a way to tell which of those small aneurysms are the unstable ones, the ones destined to grow and rupture? That would be a true game changer, and it would change how we manage this silent threat forever.